Now getting back to the process of an interpreter accepting a mental health assignment. Before accepting mental health assignments, interpreters need to be aware of what their role entails and all the challenges that can present themselves in the mental health environment. An interpreter needs to be aware of the different mental health evaluations that could occur and the different therapy options that will be offered during that process. Now, sometimes the mental health hospital will give interpreters a heads up. They will inform them of the patient and what type of setting that they could be entering into. Now, for example, the mental health hospital could contact the interpreter and let the interpreter know that we have a 15-year-old female that is contemplating suicide. After the interpreter has that information, the interpreter then needs to know what to do with it. First, an interpreter needs to realize whether or not they are comfortable accepting that mental health assignment. After determining that, they then need to decide if they're comfortable with the different mental health evaluations and therapy options that are going to be offered. And in order to do that, they need to prepare themselves and do their research. They should use something like Google. They should research different terms and the different possibilities that could occur during that assignment. After doing their research, when they're actually in the assignment, they then have that background information to pull from. This definitely helps the interpreting process because they don't have to stop and interrupt the psychologist over and over again, because oftentimes deaf patients will become very annoyed and upset when they have to stop and the interpreter needs to clarify. So it's important to do your research and have that information to use. And even qualified mental health interpreters will turn down mental health assignments. Perhaps that specific interpreter is not willing and is not capable to work with a patient that has schizophrenia. The interpreter feels perhaps that there are other interpreters that are more qualified and they're just not comfortable with it. So it's important to realize as an interpreter, if you are going to hinder that therapy process or if you are going to be there and be open for communication to happen. Another topic that comes up in the mental health setting that is difficult is medicine. Medicine is very challenging. There are very small terms and big vocab words that are used with medicine. And again, using Google. I tell interpreters all the time, research the medicine. What does the medicine look like? What color is it? How is it administered? If an interpreter has that information, if they do their research, then when they're in an assignment, they have, again, that background information to pull from. They can expand and let the patient know what color it is or what shape it is. It's easier if the deaf patient can be told that there is an oval pill you need to take. And oftentimes, if an interpreter just fingerspells the medicine, it is easily misconstrued. So it's good to have that background information, again, to pull from. Moving on to another hard area in the mental health setting is when patients are put on a 72-hour hold. And oftentimes the deaf patient doesn't understand what a 72-hour hold is. A 72-hour hold is when the state can force the patient to stay in the mental health hospital for 72 hours. And after the 72 hours is complete, the patient does have a choice. Their option is to either petition the court because they want to be released, or their second option is to agree to volunteer to stay for treatment at the mental health facility. And that process is a huge challenge for interpreters and for deaf patients. Because oftentimes that sign volunteer is often a positive one. It means that they have a choice whether or not to stay. Now this is easily misunderstood because if they leave, there are ramifications that can happen. So again, it goes back to the interpreter and the way they interpret what voluntary versus involuntary means, and they need to sign what it actually means and not just sign volunteer, because that doesn't give the deaf consumer all of the background information that they need to make an informed decision. And again, doctors will often just say, do you want to volunteer to stay for treatment? And if an interpreter just signs, do you want to volunteer? It can be misunderstood. You're telling the deaf consumer that they have an option, when really it's very serious if they choose to leave. What could happen after that? So it's important, again, to give them that expansion, to let them know what it actually means to volunteer versus not volunteer to stay. Now moving on to another aspect of the mental health setting and how tough it can be. Oftentimes interpreters will see patients locked up, they will see them in restraints, and you will see that patient in the worst point of their life. Oftentimes that same interpreter could have interpreted for the deaf consumer out in the community and have seen them in different settings, and then all of a sudden they see them in a mental health hospital, and then they interpret for them there. So it's very important that the interpreter has compassion for the situation and for the patient, and leaves the patient with their dignity. What ends up happening then is the deaf patient leaves the mental health hospital and enters back into the community, and it can become an awkward situation if the same interpreter then interprets for them in the deaf community. Now, this depends on how the interpreter treated the consumer when they were a patient in the mental health hospital. If the interpreter makes judgment and makes them feel awkward in the mental health hospital, then it will create an awkward situation when they return back into the general community. So to give you an example, perhaps you interpret for somebody in the deaf community who is a strong leader in the deaf community, very fully involved in all the aspects of deaf culture. And then this person experiences some type of trauma and they end up in the mental health hospital, and you become their interpreter. You again need to remember that they are at a very traumatic state in their life. And you need to realize that you will not use the same way to communicate with them that you have in the past. Because often what happens is their language is diminished. So for example, Marika, your ASL teacher here. She is a strong leader in the deaf community and a great language role model. Perhaps if she experienced some type of trauma and ended up in the mental health hospital and you were her interpreter, you would not use the same language, the same signs, and the same terms and speak to her on the same level that you have in the past. Because after she experiences that trauma, her language is diminished, and you need to be able to match her during that specific need, that whatever she may have in that setting.